Okay. Earlier, Doc, you were talking about generalizing the data, no?
Yeah,
How do you granularize? Is that the
yeah.
word? What kind of granular data is needed to make a decision?
Ang objective natin kasi is to try to prevent it from growing bigger. What we are doing now kasi is we're trying to deal with cases as they come into the health facilities, into the hospitals. We've always thought of yung frontline as being in the hospitals, but the actual frontline is among our public health responders down to the level of the barangay. If we have that kind of capacity para makapag-detect ng cases, we enumerate them, we know how many cases are coming from the barangays, but we haven't really maximized technology yet. There are a lot of applications that I guess you've seen them advertised, you've seen them endorsed by our interagency task force and our national task force. We have these contact tracing applications that can be used. Some don't really want these or parang nahihirapan sila. They believe that kaya ng mga health officials natin, our barangay health workers to do the contact tracing, but it's immense work. In fact, I just want to highlight that when we had our SARS outbreak, we had to have 1 week, and it took us like an army of epidemiologists and contact tracers to just do contact tracing for one case. So ganun kahirap talaga siya. The army is like the whole office sa Epidemiology Bureau in the Department of Health, and even our regional and provincial and local government unit epidemiologists. So talagang it's immense work kasi we're looking for highly mobile people here, mga super spreaders natin. With technology, we hope that we can identify them early so that we somehow outpace yung virus. If we detect them early and or somehow predict where they will be, doon natin makikita kung paano natin prevent yung pag-spread niya. It all begins kasi sa yung microcosm of the community or the neighborhood. Ang nakikita natin madalas we speak of data in terms of the region and in the city. Ang kailangan talaga natin tingnan yung sa level of the barangays.
I see.
And mind you, in the report of Professor Guido and Professor Ranjit, they had a certain list of caveats. One of those caveats was that we are not detecting enough cases in the community, yung mga tinatawag na asymptomatic cases.
Yes.
This may be the driving force really of yung epidemic. Kasi we know that COVID-19 is unlike any other viral disease. It's a disease that it's very infective na even before you really have the symptoms, pwede ka maging pre-symptomatic, and even in some people who have no symptoms, they might really pass on or be a carrier of the disease.